Hello everyone, this is Dr. Priya Gaikwad. I am a consultant psychiatrist at Mindcare Clinic, Nigri. Today we are going to talk about a very sensitive and different issue. It is related to someone very important in everybody's life. That is our mother. आई म्हटले की वेगळेच इमोशन्स आपल्या मनात निर्माण होतात. शी इज अ प्रोव्हायडर, शी इज अ हेल्पर, शी इज अ नर्चरिंग फिगर इन आवर लाईफ. But have we ever wondered what our mother or what mothers around the world go through during this journey of becoming a mother? See, becoming a mother is not only a very joyful and fulfilling moment for a mother, that is what the world looks at it as, but also it is a period of a completely different endeavor in your life. It is challenging at times. It is very stressful. Nonetheless, it is joyous. But sometimes there are unforeseen difficulties also during this period. That is why having a good mechanism to cope with these difficulties is very important for all mothers to be. That is why let us focus on maternal mental health today. That is the mental health of a mother. Pregnancy itself is a challenging feature. It's a new life growing within you. आणि त्याच्याबरोबर येणारे बरेचसे प्रश्न, sometimes even insecurities. की how is this new life going to be? Am I going to be able to manage this new phase in my life? Is there help always available when I need them? What if I can't do this all alone? What if there is some problem with my child? What if some problem arises in the period when I'm supposed to raise them? What if I go wrong? What will happen to my child? See, there are so many questions, there are so many insecurities, and sometimes they increase to a level that they pose a mental health problem for the mother. They can have problems not only during the period of pregnancy, but the most challenging period, that is after childbirth, that records maximum number of mental health issues. Somewhere, sometime you might have heard about entities like postpartum depression, postpartum anxiety, or even postpartum psychosis. These are quite difficult to notice, to understand, and sometimes go unnoticed in many women in India. But if they increase to a certain level, when they become very severe, they can pose a danger not only to the new mother but also to her child. That is why it is important to always have an eye out for these entities. The more challenging question is, even after you are able to diagnose these entities, it is very difficult to keep them on good treatment. Mostly because of the fact that majority of the medicines are going to be contraindicated not only during pre-pregnancy and pregnancy period, but even after childbirth, because mostly the child is going to be on breastfeeding, and breastfeeding means the child is going to get exposed to these medicines and the effects and side effects of the same. So then now what are the options? Many a times some simple changes in lifestyle or even some lifestyle modifications can help you not only avoid these issues during pregnancy and postpartum, but on a mild level, they can be even treated with them. So what are these lifestyle modifications or techniques that we are talking about? These include some of the changes like including healthy exercise routine in your life, good dietary habits like avoiding caffeine, alcohol, smoking, periodically de-stressing yourself with the help of some mind relaxing exercises or relaxation techniques like meditation, and then maintaining a good sleep hygiene, which is the most likely, not looked at factor in mental health. Taking good rest, good sleep, helps you refresh yourself, get better, not only mentally but also physically, and deal with these challenges more refreshingly. So, again, a figure who is so important in our life that she brings us to life should definitely deserve importance and care during her mental health struggles. So, to all the mothers, please be careful during your period of pregnancy and post childbirth and take care of yourself better so that you can provide a better future and a better life for your young one. Thank you.